I remember one thing that you and I have spoken about before is going back to lumpectomy versus mastectomy and breast conserving surgery versus mastectomy broadly, is that if we look at outcomes, there's a lot of data on breast conserving surgery that shows optimal outcome while minimizing quality of life impact. And yet we see patients who qualify for breast conserving surgery choose a double mastectomy or a radical mastectomy. Can you talk to that a little bit and how having tools like the videos, having better patient-facing material, education, assets might start to reduce the kind of discrepancy we're seeing or the behaviors we're seeing?
Sure. So that's a relevant question, especially in the US, where I think we've seen like a two-third increase over the last decade or something of mastectomies versus lumpectomies. So overall, I think the patient choice leaning towards mastectomy is because there is fear and anxiety. Definitely hearing from a patient perspective before the patient makes a choice, meaning talking to survivors, talking to people who went through similar scenarios, will definitely shed some light and allow the patient to make a more reasonable decision rather than a very emotional decision of take the breast away, I don't want it. I don't want to deal with it. Downside of not having that perspective is you only see phenomenal outcomes. You see patients who have double mastectomies and have excellent reconstruction, and movie stars who, we actually believe in the Angelina Jolie effect, where everybody thinks they're going to look like that. But it takes a lot of work to look like a Hollywood star. And that breast implant needs constant revision and body contouring. And while their careers may depend on that, so they pay attention to that and they plan for that. If you're a busy mom of 5 trying to just juggle things at home and your implant contracture is just there for the next 5 years, you really didn't get a fantastic outcome, even though you thought having the double mastectomy and having implants will make you look much younger. So there is some form of cosmetic bias there. The second is the fear and anxiety of, I don't want to ever face a mammogram again.
Yeah. Quick pause. I'm Samira, a cancer survivor. This channel shares real stories in an easy to understand fashion, guidance for the hard moments during the cancer experience. If this helps you and it helps you having us in your corner, you can subscribe for more videos like this. Now back to the show.
And that is real. And we should look for a more painless form of, getting tested. However, I have a very, very impressive volunteer survivor who will actually goes out and talks to patients who are cancer survivors that don't want to face their mammograms. And she actually will follow them for a whole day and take them when she goes for her waxing treatments and other cosmetic treatments, which she feels are way more painful than a mammogram. And her aim is to say, this is Geraldine Lucas, and she has actually an organization that does that. Women who explain to patients saying, go for your mammogram, it's not as painful. I'll come with you. But before that, come with me and see how painful a Brazilian wax is. So why are you refusing to have your annual mammogram? So, there are very interesting aspects of this, but it's so powerful when it comes from a patient rather than from me just, in a purely advisory role telling the patient, you should get your mammogram. Yes, we treated your cancer, but you still need to check your breasts. We need that imaging. So
I that is now stuck in my head. A Brazilian wax versus mammogram screening, which is more painful. Thank you for watching the Patient from Hell podcast. I started this because I wish I had something like this when I was going through cancer treatment. On this show, you will find videos and stories from real patients, real survivors, clinicians, researchers, oncologists who share their learnings, life lessons, tips, and tricks. to hopefully make the cancer experience just a little easier. To find more videos and stories, you can subscribe or share this with someone you think this will help. Thank you.